Welcome to this special interview on the personal side of medicine, offering a unique perspective on the values and principles that shape the person who wears the white coat. I'm joined with a distinguished doctor who's dedicated her life to healing. Thank you so much, Dr. Chang, for joining us and sharing your personal side.
Thank you so much for having me today. It's a privilege to be here.
So what inspired you to go into medicine and then urology?
For medicine, I remember as a very young child going to clinics with my father. So you see, my father was also a surgeon. He was an orthopedic surgeon, and he did a lot of charitable work on the weekends. He would offer his services for free to see patients without insurance. And I remember as a child seeing how grateful those patients were at offering his expertise, his time, and I saw the human connections he made with these patients, and I wanted to be part of that, and that really drove me and inspired me to become a doctor so that I can similarly offer my skills, my expertise, and my passion to people suffering with disorders. For urogynecology, it was really a calling that came to me in residency. You see, I did my OB/GYN training in Boston at Harvard, and during residency, I remember this one day I met a patient who had been suffering with pelvic organ prolapse and urinary incontinence. She had been living with this condition for years, but she was afraid. She was afraid to seek care. She was afraid to talk about it because it was an embarrassing condition to her. And I still remember walking into that room, meeting her, and hearing her story and wanting to help her because I wanted to help her regain her quality of life, to help her become the person she was. And that has motivated me to pursue additional training. I did 3 years of additional surgical training in female pelvic reconstructive surgery, which has allowed me to become a highly trained surgical specialist to offer these procedures for my patients.
That's wonderful. So what hobbies or interests do you pursue outside of work that influence the work you do?
I am a hiker. I hike all the time. My husband and I, we have hiked Mount Kilimanjaro. We've hiked the highest mountain in Taiwan, which is where my family is from. And we have hiked in Denali. We have hiked in many, many mountains in the United States. We're big fans of national parks, of beaches. We go to state parks all the time. In fact, we live right next to Bolsa Chica State Park, and we go on strolls in there all the time. And whenever I am hiking, I am reminded of these journeys that my patients are on because hiking a mountain takes a lot of hard work. There's a lot of stones in the way, a lot of curving path, and much of that is like a medicine of my patients' journeys. And when I am hiking, it reminds me a lot of the challenges that my patients go through to get the care, but when they get to the top, or when I get to the top of the mountain, it's like them receiving the care that they needed. And then from there on, you get this beautiful view and you get this beautiful perspective. And that is what I love outside of work.
What personal experiences have you gained through your work that have influenced your worldview or your personal value?
That's a great question. You know, I often talk to my mentees, and those are the medical students and the residents, that being a surgeon, it's important to be academically excellent. You have to be well-read, you have to be up to date, you have to be a great surgeon, you have to have good hands, you have to be skilled, you have to be meticulous. But just as important is to be a good communicator and to be a good person. And that's the privilege I have every single day in the clinic because I get to talk to my patients behind closed doors to hear about their stories, these very deep personal stories that they don't share with anybody else. And what I take away is that I have become a better communicator. I am more empathetic. I am more compassionate because of all these interactions I've had with patients. That has allowed me to become a better physician, and I'm grateful for that every single day.
You can really see that come through. What do you believe are the most important technical and personal qualities for a urogynecologist to possess?
With regard to technical qualities, I do think you need an excellent set of hands. They need to be steady, and you need to have a very calm demeanor, because you can be the most excellent surgeon, but you always have to be prepared for any complication that can occur. So you want to be calm, you want to be meticulous, and you want to be very thoughtful. You also want to be a surgeon that offers different options, and that's something I strive to do. For example, for my prolapse and incontinence repair, I don't just offer one surgery. I offer different surgeries based on what my patients want. So that means robotic surgery, laparoscopic surgery, or vaginal surgery. So I really listen to my patients and hear what they want and offer a tailored surgical plan for them. So these are skills that I think it's important for a surgeon to have, technical skills to have. With regard to personal qualities, I think you have to be a really good person. You know, I would want my doctor to be a good person, and that's what I try to do every day. I show up in the best version of myself. I am ready to talk to my patients. I hear them. I hear what their concerns are. I hear what they would want, and I work with them based on their personal circumstances to come up with a plan that works for them.
What is most fulfilling and motivating about the work you do?
Without a doubt, it is the day I walk into the clinic room when I see my patients for their post-operative visit. That is the day that I see them with a big smile on their face, because they had recovered from surgery and they are seeing the results of the surgery. And I love these post-op visits because I get to see the patients who are so happy with the care that they've received. And what I always hear from the patients is when I walk into the room and the patient has a big smile on their face and they say, "I wish I had done this sooner." Because that is a reminder and a continued motivation for me to provide care for these patients, because they're so grateful and they're so happy, and I'm so glad to be part of that change in their life to help them become who they truly are.
How do you cultivate the most important skills of effective communication and building of trust between your patients and their families?
That's a great question, and that's something I talk about a lot of time with my mentees. So you have to know, outside of work, I'm also a mom, I'm also a partner, and I do a lot of listening. I listen to my children, I listen to my partner, because that improves communication. And I do that in the office too. I listen to my patients, I understand where they're coming from, and I try to understand where they would like to be. So I do think there's a lot of overlap of who I am because of my background, which is as a mother, as a partner, and as a doctor. And all of these things require me to listen, to talk, to engage, so that I can be a good communicator and make people feel satisfied and happy in their situation.
Oftentimes, there are patients that have hesitations or concerns. So how do you address that when they're seeking your care or hesitant about seeking your care?
Yeah, and that actually happens quite commonly, given what I do, because I treat people with pelvic organ prolapse and pelvic floor disorders. These are really challenging topics to talk about. A lot of people don't feel like they can talk about it freely, and I understand that. So I spend the first 5 to 10 minutes trying to understand, what are their hesitations? Was it a bad experience? Was it what they've read? Was it because of something that they're afraid of? So I spend time first to try and understand that, so I can help resolve that, so I can help improve upon past negative experiences, to hopefully provide them with the treatment that they're seeking.
How are you involved with and preparing for the changes that are coming to the field of urology?
There are constant evolutions, which is something that led me to this field, because I did not want to be in a specialty that was stagnant. I wanted to be in an exciting field that was constantly evolving, and this is definitely the field. I perform clinical research, and as part of clinical research, I am constantly thinking about new ways to improve surgical techniques, to get my patients to recover faster, to have minimal complications, and to have better treatment outcomes. And with that requires a lot of creativity and a lot of innovation, which is what keeps me excited and motivated every day, because this is not a field that is remaining the same, but we're evolving, we're growing, and I have no doubt in 10 to 20 years, we are gonna be in a better place than we are even today. And I love that about urogynecology.
Well, your dedication to your patients and profession is really inspiring. We wish you all the best in your continued efforts to make a positive impact on this world.
Thank you very much for having me today. I really appreciate your time.
Of course. Let us all take a moment to reflect on the values and principles that shape our own lives and the impact we can have on the world around us.